launch the national health policy today to the glory of God.
As part of activities to improve eye care services in Nigeria, the Federal Ministry of Health has inaugurated the National Health Committee and Health Policy document in Abuja, Nigerian capital city. Minister of Health Olorunimbe Mamora, who was represented, stressed the importance of vision to the socio-economic development of Nigerians, and Nigeria is part of the international community to prevent over 1 billion persons from sight loss by 2030.
Vision is important in socio-economic development of a people. Nigeria, with other member states at the United Nations General Assembly, recently adopted the Vision for Everyone, accelerating action to achieve the Sustainable Development Goals resolution aimed at committing the international community to high health for 1.1 billion people living with preventable sight loss by 2030. It thus enshrines high health as part of the UN Sustainable Development Goals. Evidence has shown that individuals with impaired vision have difficulty with performance of daily tasks, inability to fend for themselves, thus lowering their productivity and consequently reducing their contribution to economic growth of the nation.
In Nigeria, the prevalence of blindness is 0.78%, with cataract, glaucoma, refractive errors, harmful traditional eye practices, and corneal opacities as the leading cause of preventable blindness. These preventable blinding conditions can be reduced significantly through public awareness and ease of accessibility to eye care professionals, thus encouraging early treatment of the diseases. Fortunately, the Ministry, through its implementation of the National Eye Health Policy, has taken steps aimed at integrating primary eye health into primary health care, thus increasing accessibility to quality eye care and encouraging promotive and preventive eye health, especially in the rural areas that the PHC serves.
The committee expressed readiness to give their best and promise to uplift optician services and policies in Nigeria.
The eye is the window of the mind and of the body. For Sight Savers, it's a pleasure that we're working and supporting the Federal Ministry of Health, especially in developing not just a national eye health program, but one that will outlive all of us. And that's why we're throwing our weight behind the Federal Ministry of Health alongside our other partners in the NGO world.
I can only imagine what it would be for someone to really be blind. And so I can imagine someone struggling with their sight and not even seeing at all. It must be a very difficult situation. And sadly, in Nigeria, 78 persons out of 10,000 are actually blind. And many more are actually either partially blind or are going through some challenges with their eyes. So we need all hands to be on deck. It's very important for us to step this policy down to the local government level, the primary health care. I believe as we set up the committee today, it's not going to be about just the federal capital, it's not going to be a talk shop, it's not going to be the usual, but it's going to be critical for every stakeholder to really put their cap in the game and ensure that down in my village, in your village, people can access eye care and they don't have to put urine in their eyes or put water or kerosene in their eyes just to see.
The National Health Policy is first of its kind in Nigeria, and the policy will also scale up other existing eye health services and ensure that no one is left behind through approaches that ensures quality, equitable access to quality eye care services. Becky Kuju, News 24.